All right. So hi, everybody. Our presentation we did was on Phil Barker, and we are going to be just going through and doing a little early history to start with. So Phil Barker is a prominent figure in nursing and in mental health. He's had a career marked by a commitment to improving mental health care and advancing frameworks within the field. He's best known for his role as professor of mental health nursing at the University of Dundee, and his career has spanned several decades in which he has made significant contributions through practice and academia. His work has been deeply rooted in his extensive experience in mental health nursing. He's held various positions in the clinical setting in roles like patient care, teaching, and leadership, and his experience has provided him with insights into the needs and challenges faced by individuals' with mental health issues. This background of his has been instrumental in shaping his theoretical contributions as well. And throughout his career, he's been an advocate for the integration of theoretical knowledge with clinical practice, and his work has emphasized the importance of understanding and addressing the complex experiences of individuals with mental health conditions rather than just focusing on symptoms or diagnoses. And this has been influenced by both his nursing education and mental health care practices. This approach has influenced both nursing education and mental health care practices globally. So moving on, he is perhaps known for the development of the tidal model, the most worldwide. And the tidal model was introduced in the early 1990s, and it's an approach that emphasizes the importance of understanding and respecting the experiences of individuals in mental distress. Traditional models before that were often focused on pathology and treatment from a clinical perspective, and the tidal model seeks to engage individuals in their own recovery process by acknowledging their personal narratives and experiences. The core principles of the tidal model kind of revolve around the idea that mental health care should be fluid and adaptable, much like the tides of the ocean. That's where the name comes from. And it underscores the importance of therapeutic relationship and encourages practitioners to view patients as active participants in their own health journey. And a few key elements of the tidal model include personhood, collaboration, and empowerment. So personhood, recognizing and respecting the unique experiences of the person; collaboration, working together with individuals to understand their personal stories; and empowerment, supporting individuals and taking their active role in their own recovery and decision making.
All right, so then I'm going to be going over the influence that Phil Barker's title model had on the nursing profession. And it had a very significant influence on the nursing profession, particularly in the field of mental health nursing. It's a person-centered, recovery-focused model that emphasizes the importance of understanding the patient's personal story and experiences as a way to promote healing. So just a couple key points in the ways that his model has influenced nursing practice. The person-centered care approach encourages nurses to prioritize the individual needs and experience of each patient, recognizing that they are experts in their own lives. This influenced a broader shift in nursing towards a more holistic, individualized care, where the patient's voice is very central to the care plan. And then the focus on recovery, the core principle of this model is that the recovery is possible for everyone, and this influenced mental health nursing to adopt a strength-based, recovery-oriented approach. And this focuses on the potential for patients to regain control over their lives rather than just simply focusing on their symptoms. And then the use of storytelling or the narrative really emphasizes the importance as using storytelling as a therapeutic tool. It encourages nurses to engage patients in discussing their life stories and personal experiences as a way of understanding their mental health struggles. This approach inspired other narrative-based therapies and has been incorporated into different nursing practices and specialties. And then A couple other points, just wanted to glaze over the reduction of power imbalances. So this model encourages nurses to reduce their power differential between themselves and the patients. By viewing patients as equals and co-collaborators in their care, it shifted nursing practice towards towards more respectful, empowering interactions. And then the strength-based approach encourages nurses to identify and build on the strengths of the individual. This influenced nursing education and practice to incorporate a more positive, solution-focused approach. And then this had a really big impact on mental health policy, specifically in the United Kingdom. And this has been adopted into several mental health services in the country. It's contributed to the development of a more humane, patient-centered mental health care systems globally. Overall, Phil Barker's title model has fostered a shift in mental health nursing from a primarily medicalized model to one that emphasizes the individuality of patients, their stories, and their capacity for recovery, making it a pioneering framework in person-centered care.
Okay, now we're going to move on to the patient care case study. Consider the following case study. An elderly patient whose wife of 46 years recently passed away after battling cancer for the last 3 years of her life. The patient grieves counseling today. The patient describes how the events of the last 3 years wrecked him emotionally, physically, mentally, and spiritually. He's unsure of how he could ever recover. If we were to follow the title method for this patient's care, we would go about it by breaking down his treatment into a few different phases. Starting off with the personhood phase, we would give the patient the space to speak about his wife and his journey with grieving her, as well as how the past 3 years have affected him. This will give him the opportunity to open up about any of the emotions he may have bottled up since his wife has passed away. The next phase is called the water metaphor. This phase looks at a patient's journey like it's an ocean and the tides come and go. This is where the patient will be able to visualize their emotional tides and understand that grief has its highs and lows. The final phase is the collaborative phase. And with this phase, the patient will work closely with their nurse to make small goals as they work through their way through the grieving process. This phase is very much a collaborative effort between the nurse and the patient, with the nurse acting as a guide while the patient works on achieving their goals.
The nursing process cycles through assessment, diagnosis, planning, implementation, and evaluation. During assessment, the nurse is collecting information to understand the patient's current situation. In the title model, this is when the nurse listens to the patient's story. The next stage the title model applies to is the planning stage. During this stage, the nurse designs goals and outcomes for the patient. While the ultimate goal is recovery, the outcomes that the patient will need to achieve to reach that goal will vary individually. If we implemented the title model at this stage, it would appear as guiding the patient to identify what they need in their recovery. Next is implementation. Here, the nurse will carry out interventions meant to help the patient reach their goal. If we apply the title model, we would be encouraging the patient to actively engage in reaching their set goals and not just passively rely on others for symptom control. And finally, evaluation. While the title model does not have a set expectation of how recovery will appear, it does continue into evaluation. If we provided care based on the title model, we would expect to end with evaluation to know if this model of care was successful in reaching recovery during the grieving process.
All right, and those are our references. I hope everyone enjoyed listening to our presentation on Phil Barker and the title model. That's all we have for you.